All right, so we're going to finish up our section on 8.3, and we're looking at blood types today. So the blood types is the ABO system. So in the ABO system, the presence or absence of type A and type B antigens on red blood cells determines a person's blood type. So if we look here, this is a type A blood, and they have the type A surface antigens on those on that red blood cell. And if you look at type B, they have the type B antigens, the surface antigens, and then here's type AB blood type, and you can see that they have both the type A and the type B antigens, and then there's a type O blood that the red blood cells, they have neither type A nor type B surface antigens. All right, as well is what they have in their plasma. So a person that has type A blood, they're going to have in their plasma, they're going to have anti-B antibodies. In the plasma of a person with type B blood, they're going to have anti-A antibodies. A person that has type AB blood, they do not have antibodies in the plasma. And then a person with type O blood, they have both type A and type B antibodies. So these antibodies appear within several months after birth, and the presence of these antibodies can cause agglutination. And what this means is there's a clumping of red blood cells that occurs when incompatible blood types are mixed. And these agglutinated red blood cells, they can clog blood vessels, they can block circulation, and then they can cause severe damage to organs, and then it can lead to death. All right, so here in this diagram, we're looking at individuals with blood type A. They can receive blood type O during a transfusion. They can also receive type A blood transfusion as well. But individuals that have blood type O, they cannot receive blood type A during a transfusion. And we'll look at this diagram here as well. So on the left-hand side is the blood type of the recipient, and up top is the blood type of the donor. So if a person is type O, they can receive type O blood. They cannot receive type A, type B, or type AB. And we can see the agglutination happening in those red blood cells. A person that is type A blood, they can receive type O blood. They can also receive type A blood. But if they receive type B or type AB, we can see the agglutination happening in the red blood cells. Next, we have a type B recipient, and they can again receive the type O blood or type B, a blood from a donor. They cannot receive type A or type AB, all right, because of agglutination again. And lastly, a person that has a type AB blood type, they can receive any type of blood. They can receive the type O, the type A, the type B, or the type AB. All right, so again, this is showing the agglutination response in our blood groups. So in this example here, this is the agglutination response of blood type A, which is the recipient, to blood type B, which was the donor. All right, so blood type B is being transfused into a person that has blood type A, and we can see here that antibodies are produced against that B antigen. The red blood cells that contain that B antigen were clumped together, which is agglutination. All right, let's see here. A patient with type A blood has type A antigens and they have the type B antibodies. That's why they cannot receive type B blood. The anti-B antibodies in the plasma of a type A person will cause clumping or agglutination of the type B blood cells, and it can be fatal. Same reason, that's why they cannot receive the type AB blood, because it also contains the B antigens. So people that have type AB, they are referred to as universal recipients because they're able to receive any blood type without a reaction because there's no antibodies in the plasma. And individuals that have type O, they are known as universal donors because they can donate blood to anyone since the cells have no antigens on the surface. All right, but keep in mind that person that has type O as a recipient, they can only receive type O blood. All right, so type O is a universal donor. Type AB, they're universal recipients. Next is the Rh system. So this is another group of antigens that are found in most red blood cells. It's the Rh factor. So people with the Rh factor on the red blood cells, they are termed Rh positive, shown like this. And then people without it are Rh negative, so shown like this, Rh minus. So individuals who are Rh negative, they usually do not have antibodies to the Rh factor, but they may make them when they're exposed to the Rh factor during a blood transfusion or during pregnancy. All right, so during pregnancy, if a mother is Rh negative and the father is Rh positive, the child may be Rh positive. And the Rh positive red blood cells of the baby may leak across the placenta into the mother's bloodstream. And the presence of these Rh positive antigens will cause the mother's immune system to start producing anti-Rh antibodies. So it's usually in the next pregnancy or the subsequent pregnancy with another Rh positive baby, the anti-Rh antibodies may cross the placenta and start destroying the child's red blood cells. And this is called hemolytic disease of the newborn, or HDN. Okay, this is hemolysis is the bursting of red blood cells. And this condition can lead to brain damage, deafness, and death. So this Rh problem is prevented nowadays by injecting Rh negative women with an antibody preparation against the Rh factor within 72 hours after the birth of an Rh positive child. The anti-Rh bodies, they're in the injection, they attack any of the baby's red blood cells in the mother's blood before these cells can stimulate her immune system to produce her own antibodies. All right, this procedure will not help if the woman has already begun to produce antibodies. So the timing of this injection is very crucial. All right, so this is just showing if a baby inherits its Rh plus blood from the father, and if the mother is Rh negative, then the polyps can develop if the blood cells of the mother and baby mix prior to and during birth. All right, so here, the first pregnancy, the mother is exposed to the Rh antigens at the birth of her Rh positive child, and the mother will produce these anti-Rh positive antibodies. Then in her next pregnancy, these anti-Rh antibodies can now cross the placenta and endanger the child. All right, so therefore, that injection is required. All right, this is a sample showing what agglutination would look like. So this one here and this one here and this one here, they don't show agglutination, but here we can see agglutination happening. Okay, Basically, to determine a person's blood type, only a few drops of blood are required. Antiserums are added to each drop to determine the antigens on the person's blood cell. Although there are many identifying antigens on red blood cells, for the purpose of transfusion, only the ABO and Rh groups are tested. If the blood clumps with the antiserum, it indicates the presence of that antigen on the red blood cells. If an antigen is absent on the surface of a person's red blood cell, the corresponding antibodies are present in the serum. So, for example, Rh negative individuals have Rh antibodies in their serum that will recognize and bind to a red blood cell with Rh antigens, causing agglutination or clumping of the blood. So this prevents a donor from receiving blood types for which they have antibodies. This picture here, the patient whose blood is pictured here would not be able to receive blood from donors of type O positive or O negative. Since he has the Rh factor, he does not produce the Rh antibody and can receive blood from Rh positive or Rh negative donors. Since he does not have an A or B antigen, he produces both anti-A and anti-B antibodies, so preventing him from receiving blood with those types of antigens. So here in this example, there's no clumping with the anti-A or anti-B serum. So anti-A, anti-B serum. So it does not have either antigen. Anti-D is the antibody for the Rh factor. And then this one here is the control. The test, what we see here is it did clump with anti-D, therefore it has the Rh factor. All right, so this person's blood type is therefore O positive. All right, and next we're going to talk about immune system disorders. An autoimmune disorder, this is when T cells or antibodies mistakenly attack the body's own cells as if they had foreign antigens. The exact cause of autoimmune disorders is not known. Rheumatoid arthritis, it's a chronic autoimmune disorder. It's characterized by inflammation of the lining of the joints. It's caused by the body's own immune system attacking the joints. It causes pain, stiffness, swelling, fever, fatigue, decreased appetite. The immune system or the immune response can continue attacking cartilage, bone, tendons, and ligaments, and it can cause permanent disability. The treatment for this is for example, aspirin, non-steroidal anti-inflammatory drugs or NSAIDs, and steroids. It basically reduces the pain and inflammation. They're not actually addressing the cause of the disorder. Disease-modifying anti-rheumatic drugs also work on the immune response and slow the progress of the disorder. So this is a person showing rheumatoid arthritis. Next are allergies. This is an exaggerated response by the immune system to a harmless material like pollen or mold or animal dander. And there's two types of allergic reactions. There's immediate or acute, and then there's delayed. So during immediate, this is the most common type of allergic reaction. It occurs within seconds of exposure to the allergen, and it'll usually disappear within 30 minutes. Specialized antibodies will trigger certain cells to release histamines. These are chemicals that increase the permeability of blood vessels, making the area red and swollen. Specialized antibodies can also trigger the release of cellular fluids, which results in watery eyes and runny nose. This includes some forms of asthma, which is an immediate reaction to allergens that are inhaled. And usually asthma can be treated with anti-inflammatory drugs that will open the passageways of the bronchi and thus ease the symptoms of an immediate reaction. And then the delayed type of allergic reaction, these are allergic responses that are set off by T cells that have been sensitized by previous contact with the allergens. It's a reaction that's slower and it lasts for a longer time. An example of this is having allergic reactions to some cosmetics and jewelry. This is just showing an EpiPen. It contains single dose injections of epinephrine, which is also called adrenaline, in case a person has an immediate dangerous reaction, which is called anaphylaxis to an allergen. All right, so just to summarize about allergies, again, it's an immune response to harmless invaders like pollen or food. The most common is the immediate reaction, and there's a release of histamines, which can cause swelling, redness, itchy skin, runny nose, red eyes. And then you can take over-the-counter antihistamine medications to control those symptoms. Other types have a delayed response where the allergen triggers T cells that have had previous contact with the allergen. And then last is that anaphylaxis. That's the serious, life-threatening allergic reaction where the tissues of the tongue swell up and the throat swell up and it closes off the airway and it leads to death. Vaccines are an important component of public health. They work by activating the immune system using a dead or inactive form of the virus that it's protecting you against. It stimulates the B cells to create antibodies against the virus, despite the fact that there is no real risk to the body. So this is why a person, they might start to feel feverish and fatigued after a vaccination. Then memory B cells are formed, and then they're ready to activate your immune system quickly if you do get exposed to that virus again. All right, some quick questions here. How is the lymphatic system related to the circulatory system? So like we saw in those diagrams, there's a close association with the capillaries of the cardiovascular system. And fluid that escapes from the cardiovascular capillaries forms the interstitial fluid. Some of that fluid is collected in the lymphatic capillaries, but eventually does get returned to the blood. How does the lymphatic system help to protect the body from infection? We talked about with the white blood cells to protect the body against infection. These white blood cells, also called lymphocytes, they mature in lymph nodes, which are the glands found throughout the lymphatic system. And they contain macrophages, which can trap and destroy bacteria that is circulating within the body. All right, let's take a look here. We have a chart showing 1, 2, 4 individuals, individual A, B, C, and D. These are the antigens on their red blood cells. So type A has antigens A and B, type B has none, type C has A, person D has type B. So again, these are the individuals A, B, C, and D, and these were their antigens on their blood cells. These are their antibodies in their plasma. So individual A does not have any antibodies in their plasma. Individual B has antibodies A and B. Individual C has anti-B, and individual D has anti-A. And lastly, Rh factors. Person A is Rh positive, person B is Rh negative, person C is Rh positive, and person C is Rh negative. So it says which individual from the chart above would have type O negative blood. All right, so the answer is B, because they don't have antigens on their red blood cells. All of the individuals identified in the chart above are females, all had previous pregnancies with men who were Rh positive, and all become pregnant a second time. Which individuals in the chart would have to be concerned about hemolytic disease of the newborn? All right, so person B and person D, right, because they have the Rh negative factor. All right, and we'll stop here and watch these couple videos on the immune system